Does nursing school prepare you for medical school? Hi, I'm Dr. Bryce. I'm an OBGYN resident and mom of 5 in West Virginia. And let's talk a little bit about the differences between nursing school and the prerequisites for medical school. As always, please like, follow, and share. And at the end, I'll give you my very last tip at the very end. So, in short, no, nursing school is not equivalent to medical school. Even if you're getting your BSN, you're not doing the same foundational science classes in a nursing program that you would need to do in order to take the MCAT and be accepted into medical school. And it is important that you actually take those classes because medical schools are specifically looking for your grades in things like intro to biology, intro chemistry, organic chemistry, etc. It's going to be really important that you have those classes. Additionally, you will not do well in the first, especially year of medical school without those foundational classes. You just won't. I know that's frustrating to hear, but it's just the case. So nursing school teaches you how to be a safe and effective nurse. Effective might not be the best word, but how to be a safe nurse. The goal is that you are able to do the nursing tasks, and it's much more task oriented than medical school and being a physician. So physicians, there tends to be a lot more talk and thought process about why you prescribe a certain medication or why you recommend a certain procedure and things like that. So it's more about the diagnosis and then treatment of the disease or the problem versus nursing, which is then the administration or the action of following then those orders. So yes, you need to know why what a medication is prescribed for, but what's more important from the nursing side of it is that you know how to safely administer it, because from the time the doctor orders a medication or a procedure that a nurse could perform, like say inserting a Foley, things may have changed. And so it's very important that the nurse knows how to safely do those tasks. And that's a lot of what nursing education is about. It's also about being able to continuously evaluate the patient and be able to provide that nursing assessment, which is a key component for the physician. So the way that when a lot of people ask me what the benefit of being a nurse before I went to medical school was, the big benefit for me was that I knew sick from not sick. I couldn't always tell you what was wrong as a nurse, or I couldn't always use the big doctor words to describe everything, but I could look at a patient and say, this patient is sick and this patient is not, or this patient is heading towards something that I don't like. And that is a very good skill to have coming into medical school. And that is something that most nurses are really good at, is they see that patient, they talk to that patient the whole course of the day. So they see the subtle changes that the physician who is seeing more patients throughout the day doesn't necessarily see. Even if we've rounded on them once in the morning and once in the afternoon, we don't necessarily see the subtle differences that the nurses pick up on. So it's just different. So how to go about it. If you are a nurse who wants to go back to medical school, my advice to you is to find the cheapest courses that you can. And sometimes, especially if you don't already have your BSN, you can sneak in the back door and let them think that you are getting a BSN and then take all of the gen eds. So you can get accepted into, say, a local state school like I did. I went to Millersville to redo all my gen eds. And they were like, oh, you're a nurse. We think you're going to do your BSN. And then I didn't take any BSN courses. I registered for all of my gen ed courses, and I was able to take all of those as a bachelor's level and not pay the higher post-bac course price, because the post-bac course price is like double or triple what your initial bachelor's degree type class is. So that's my suggestion, is to take it as a bachelor's degree and not a post-bac, because the medical schools aren't going to care whether it was actually a post-bac program or another bachelor's degree, but the bachelor's degree is going to cost you a fraction of what the post-bac does, because it's not considered a graduate degree. So that's my advice.